In the greater Cedar Rapids community, progressive rehabilitation medicine provides advanced, non-surgical pain management solutions, such as physical restorative therapy, ultrasound-guided intervention, pulse electromagnetic field therapy, electrodiagnostic medicine, and deep tissue laser therapy.
By the time they get to our clinic, they have essentially failed all conservative measures before. It could be trigger point injections, acupuncture, medications, massage, physical therapy, any of those offshoots, cupping, stretching, any of that, epidurals. So most of the time they've already tried and failed all of those things. So we're kind of their last hope on what they want.
At Progressive Rehabilitation in Cedar Rapids, our most popular therapies are the hyperbaric oxygen chamber therapy, regenerative biologics, in true non-surgical spinal decompression, utilizing the DRX9000.
We are proud to have evidence-based technologies such as the DRX9000, which have studies done on it, done by doctors from Johns Hopkins, Mayo, Stanford University, among other prestigious universities, which support its claims.
You know, I can't sleep on my back, I can't sleep on my stomach, I have excruciating pain. And I'm a nurse, and so, you know, doctors just want to give you oxycodone or codeine, and I would refuse to take that because I had to function, you know. And so I would take tons of ibuprofen all the time, and I just learned to kind of live with the pain. And at the beginning, you know, I was a little, I guess a little fearful, because everybody is, of the unknown. But when they put me in that harness and I was up there, I was expecting, you know, severe pain, but praise God I didn't, you know, and I felt on the second day, I felt, you know, people think, really, on the second day you felt something better? But I did. I really honestly did.
Dr. Sunny Kim is board certified in physical medicine and rehabilitation and is an alumni of the prestigious Cornell University, Johns Hopkins School of Medicine, and Rutgers Medical School. Dr. Kim is the first DRX9000 certified provider in the great state of Iowa.
The DRX9000 pulls on the spine using logarithmic curve, which is a type of pull that's been proven under scientific scrutiny to be able to achieve true decompression. And that study was published in the Journal of Neurosurgery by Dr. Ramos and Martin.
I've been treating patients with DRX9000 for approximately 20 years. And I've been very impressed with the clinical results. 90% of the patients are significantly improved.
When I finally got the MRI and I realized that I had an L4, L5 herniation, I was really dragging my leg around and having a hard time sitting, having a hard time driving. I was in excruciating pain. I was just in a lot of pain, and I thought, well, let me figure out what medicines I can take. I was hoping that it would just go away. The last thing I want to do is surgery. That would be my last choice. And we started the DRX9000 treatments, and most of the symptoms were gone after a couple of weeks being on the machine. It worked almost immediately, for me at least. This treatment's been a lifesaver for me. I'm able to come back and work without any limitations anymore. Having surgery is a big deal. This was non-surgical. This is something I could do for 30 minutes, you know, a day, and it showed a great improvement. We've been able to get most of my symptoms away, and I'm back to work.
One of the features of the DRX9000 which allows us to be successful in treating difficult spinal conditions, is the ability to very precisely change the angle of pull to target a specific disc level in the neck or in the lower back, so that you get targeted decompression of the area of the spine that needs most attention.
But they've gone from a pain level of 9 to maybe 1 or 2 or something like that. A lot of them are asymptomatic. And it's very impressive. Does that treatment last? Yes, it lasts. And so I have a lot of patients. I never see them again. And some of them had large extruded herniated discs with blockage of the central canal, and they're back doing even normal activity. I've treated over 1,000 patients with both the lumbar and cervical DRX9000 unit. And the improvement is seen in all areas. So the DRX machine will help pull the disc back in, help increase the height of the disc space, help improve the space of the spinal cord and the spinal nerves going through what's called the central spinal canal, and help decrease central spinal canal stenosis, primarily by getting the disc to move back where it belongs.
What really drives us here at Progressive Rehabilitation Medicine is getting to the root cause of the problem and offering specialized treatment technologies that actually work. And our goal is to reduce pain and suffering, reduce disability, get people back to work, and improve quality of life. And what really drives us and motivates us is seeing the successes. People who could not walk, walking again. People who were literally in their bed all day long and now walking 1-2 miles a day. This is an astounding feat. And there's limitations from traditional medicine. Traditional medicine is often driven by pharmaceuticals. Many of the drugs are habit forming, like the opioid. There's a opioid epidemic out there. And we've learned over the years that that's not a good thing. It's actually causing more problems than good. Traditional medicine likes to do a lot of surgeries, but we've discovered ways to treat the body in such a way as to tap into the inner natural ability of the body to heal and avoid unnecessary surgeries, avoid potentially habit-forming and harmful pills, drugs, and chemicals. But what really drives us is being able to see the successes from all the hard work, from traveling around the world, from working with some of the top doctors and other medical providers. We've been able to harness the best technologies and bring it all under one roof to get the best possible results.
For more information on the DRX9000 or Dr. Sunny Kim, please call +1 319 393 1320 or send an email to info@drx9000.com.